Good afternoon. My name is Wendy Willauer, and I'm here to discuss with you strategies of reducing indwelling catheter-associated urinary tract infections, along with reducing high medical costs related to these infections. Research suggests that the use of indwelling catheters has downfalls related to the elevated percentage of urinary tract infections and high financial costs, so healthcare providers should put strategies in place to reduce infections and the costs associated with indwelling catheters. According to Bernard, Hunter, and Moore, 2012, out of all healthcare-acquired infections, urinary tract infections make up an astonishing 35%, with 80% of these infections caused by indwelling catheters. Due to the length of stay and intensive treatment required for these urinary tract infections, the healthcare system takes a tremendous hit financially. Indwelling catheters can cause urinary tract infections that are detrimental to the health of people, especially the elderly population. These urinary tract infections are also a challenge to healthcare facilities that have to use indwelling catheters for beneficial and therapeutic use for patients, according to Quinn, 2015. There are ways to reduce these infections. For example, there are inexpensive methods such as virtual and physical reminders. These reminders are helpful in reducing the amount of urinary tract infections, as well as decreasing the usage and duration of indwelling catheters, as found by Blogget 2009. Our visual aid chart from Quinn 2015 shows a reduction in catheterized patients and the total duration of days patients were catheterized from 2008 to 2013. The total acquired catheter-associated urinary tract infections were significantly reduced, along with the reduction in incident rate of the urinary tract infections from these indwelling catheters. So the numbers have went down. The less time they used them, the less people they placed them in, the numbers had went down, so you have a real small incident rate of urinary tract infections from these indwelling catheters. There are strategies to make these high-cost urinary tract infections more cost-effective. According to Quinn 2015, an estimated $1,200 to $2,400 is spent to treat each incident of catheter-associated urinary tract infections. With this costly amount per patient, the key initiative is to reduce the incidence of expensive catheter-associated urinary tract infections with strategic plans. Bernard, Hunter, and Moore, 2012, suggest two of the most important priorities in preventing catheter-associated urinary tract infections are using the indwelling catheters only when they are absolutely necessary and making sure they are removed as soon as possible. However, Weldon, 2013, suggests that the best standard of care for patient safety and cost effectiveness of the facility is for the registered nurse and team to deplete every other possible option available before actually placing an indwelling catheter. Reducing the insertion and placement of indwelling catheters promotes a decrease in number of patients at risk for catheter-associated urinary tract infections. There are times patients will need these indwelling catheters for therapeutic treatment. Patients who absolutely need insertion and placement of indwelling catheters should be monitored every shift to determine the need for continuing the catheter placement or if the catheter can be removed. By reducing the length of time of catheter placement, the number of urinary tract infections will decrease, along with keeping patients healthier as well as keeping financial costs to a minimum for healthcare facilities.